All right. So I'm excited to be with Dr. Kimberly Griggs, marriage and family therapist. And I'll begin by asking her about her training, kind of like where she went to school. And then we'll get into some questions about how she knew she wanted to be a marriage and family therapist. But let's start with her training.
Okay, so hello, everyone. So let's get right into it. So again, my name is Dr. Griggs. I just actually graduated from Alliant University in 2020
Okay.
with my PsyD in psychology.
Mm.
Before that, I went to Antioch University in 2005, where I had my master's in clinical psychology.
Okay.
And then prior to that, in 2001, I went to Hampton University where I graduated with my BA
Okay.
in advertising and marketing, which was quite different. But that is my educational background.
Okay. So, as I think about it, we had another interviewee who went to Hampton. That's a historically Black college in Virginia, right?
Right.
Right. Okay. And I'm liking that Southern California return connection. That's a good thing. So when did you know you wanted to be a marriage and family therapist or work in psychology in some way? When did you know?
I took an interesting path because when I came back to California from Virginia, I went to law school for a year.
Hmm.
I didn't like that too much.
Right.
I traveled abroad. I went to West Africa, I went to Europe, and then I did some soul searching. And I think I met you. No, actually, no. When I came back, I started my master's in clinical psych, and that was an interesting experience because I was at Antioch University, which is a private school.
Yeah.
I just really grasped onto the concepts. I just like learning about behavior, the human mind. I like that whole time at Antioch. From there, I went and I think I met you at Cal State Long Beach. I was looking at doing a school-based credential, a psychology credential, but then I decided I liked more working in a clinical-based setting. So I went, and I started my doctorate a few years later at Alliant. I just thought that working in the clinical-based setting and I found that was more up my alley. I liked working with trauma-based. Sorry, getting a little tongue-tied. I liked working with different populations, and I think the school-based setting was not where I needed to be. I just really liked working in a clinical-based setting with populations experiencing different forms of trauma.
So was it like you liked working more one at a time, or was it the kind of the pacing of the work that you were doing in the clinical setting?
I think the clinical setting offered a different type of just experience for me. I worked at Julianne Sanger School in West LA. I used to work with autistic students for a while. From there, I moved to Drew Child Development, which is it's a mental health-based center in Los Angeles, and I worked with a lot of I worked in the community-based setting where we did a lot of clinical interventions, um, uh, working with children, working with families, working with substance abuse, marital problems, suicide, stress management. So that's the area that I really enjoyed working with. So yeah, that was my population that I really felt I had a connection with.
Right. So it sounds like you just wanted the full range, working with the whole family and in a range of issues. Yeah.
Yeah, I did. It took a while to really find my niche, which is where I'm working now. But I think just as I moved up the ladder from Drew, then I think I worked at a few other agencies in Los Angeles.
Mhm.
Yeah, I worked at West Valley Detention Center, which is one of the largest prisons, or one of the largest jails in Los Angeles,
Mhm.
as a clinician.
Yeah.
So I just moved up the ladder and just went to different populations just to see where I fit in the most, and just getting different experiences with inmates, with children in foster care, with children in adoption, with DCFS, with gay and lesbian teens, and just
Mhm.
working with all these different populations. Just um, I don't know, it just made me become a better clinician, and yeah, that was my passion. So
Okay. So, what brought you to San Diego?
yeah, it's a long question. Um, I wanted to move my practice down to this area.
Mhm.
I thought I work with people from all over Southern California, but I wanted to move down to San Diego, just because the area is beautiful, of course.
Yeah. Yeah.
Yeah, I just wanted to change. I
Yeah.
was in Rancho Cucamonga, which is in the
Mm.
Inland Empire of
Yeah.
Southern California, for a while.
Yeah.
Um, I was in Long Beach for a while, but yeah, I thought San Diego was a place I wanted to raise my kids,
Mm.
and I work with the VA population. That's one of my
Mm.
major providers that I do work with. So just working so close to, all the bases,
Yeah.
it's advantageous for me to be
Yeah.
in this area. I get a lot of
Yeah.
trainings. I have a lot of connections. Yeah, it's a good spot for me. So yeah.
One of the things I tell students that if they are going to specialize in working with veterans, unfortunately, just given, where the world has been the last few years, they will always work. And if you come to a place like San Diego, there's plenty of need. So,
Right.
shifting gears a little bit, have you been involved with any professional organizations or anything like that?
I am with CAMP, the California Association of Marriage and Family Therapy,
Okay.
Alpha Kappa Alpha sorority.
Mhm.
Yeah, so I do some stuff there. I'm busy being a mom
Right,
most of the
right,
time,
right.
but those are some of the organizations I am involved with. I'm trying to, hopefully next year I'll be able to extend out a little bit, but
Okay,
yeah.
good. What's been your favorite part of the job?
My favorite part of the job. I love working with, again, the veterans. I'm a private practitioner. I have my own practice, but I work with a lot of civilians,
Mhm.
such as Kaiser. I have a contract with Kaiser,
Mhm.
just different providers in the area, Optum. I like the civilian work. There's different areas that I like with civilians,
Mhm.
but with veterans, it's the trauma-based care that I especially um, like. The EMDR, I do a lot of eye movement desensitization
Right.
and reprocessing therapy with the veterans,
Okay.
and
Okay.
I specialize in that area. Um, uh, CBT, narrative-based interventions. Um, yeah, a lot of more of the newer neurological interventions using polyvagal theory. So
How did you get trained in that?
different trainings I have been connected with since 2005, but EMDR, I think there is EMDRA, EMDIRA. It's an institute, and
Mhm.
I think they expanded. So they offer the trainings at different sites now, but EMDRA, I think, is based I believe, on the East Coast, but they move all over. They have different workshops all over the country.
Right.
Um, yeah, so it's an intensive, 3-day training, I believe. You have to stay at a hotel, and then you do another intensive training. But it's pretty, um, yeah, it's a very detailed oriented um, intervention. So it was quite thorough. So I do really enjoy providing EMDR to the veteran. population.
So it's a lifelong learning that you're doing.
Yeah, it's constant learning. I learned each of my patients bring something to the table where I need to go research something, and I say, oh, let me look at that and let me examine that, and let me see how I can better work with this particular person, our family, our system. So it's constantly evolving, constantly changing, constantly keeping yourself on your toes, because you have to stay updated with the latest interventions, latest technology.
Right.
So yeah, it's an amazing field to be in.
Yeah.
If you like working with people, if you like working with systems, if you like just I don't know, just understanding how to implement change on both that individual and systemic level. I think just working in the field of psychology offers so much opportunity. You can do anything. You can go anywhere. You can, you can work in a corporation. You can work in community-based settings. So it's amazing.
It's the most challenging part of the job.
Oh, having to work with CPS, doing a lot of abuse reports over COVID.
Child Protective Services, CPS, yes.
Yes, that can be quite difficult because sometimes they pull children out of homes, and you have to, as a mandated reporter, you have no choice but to report. But it can be quite difficult. It's stressful knowing that what you heard caused you to have to make a report, which caused a child to be removed from their home, a family to be essentially torn apart for a while. So that's, you lose sleep sometimes over that. You keep going because your work is, what you're doing is for the greater good.
Right.
Yeah.
So someone wants to get into this field, they think it's going to be exciting, or let's even narrow down for those who are considering graduate school in general, because you went to law school. you got into a school psychology program, you got into a clinical psych program, you got into a doctoral program. Any advice for people getting into graduate school? What do you think they need to do to be ready to go from undergrad to graduate school?
It takes a lot of soul searching. I always laugh because when I started my doctorate program, I was married and had one child. When I left my doctorate program, I had two children and I was divorced. So it changes you. The intensity, the passion has to be there. You have to have a love for what you're doing. Moving from undergrad like to a master's program, even it's a lot of work, a lot of focus. You have to maintain that focus throughout, or you can fall off. I know a lot of people who left midway. You just didn't have that desire. But you really have to know what you want to do, and you have to reach out if you need help. And there's all type of resources, financial, counseling. You just have to make use of who you're around, your environment, the people you're around. If you're on your own, there's all type of outlets and resources out there to really guide you. But you just have to have that passion, and you have to stick to it, and you have to be consistent and know that there's light at the end of the tunnel, because it's a lot of work. It's not a joke. You've been through it yourself. So
yeah. So students who are considering your specific career, what kind of things they need to be ready for, you think?
Well, you have to take a licensure exam, which for LMFT, there's the California state license as an LMFT. That consists of doing 3,000 hours in a clinical-based setting, being supervised. It's quite a lot. Actually, I am doing another 3,000 hours because I want to sit for the EPPP, which is the clinical license as a psychologist. And I just started that, and I'm actually, so I'm a psych assistant as well, because I'm under a licensed clinical psychologist, and I have to do another 3,000 hours.
Right.
So it's just
That's something
constant. You're just
we talked about in our first class. And so we went over the hours for MFT, the extra kind of things you need to do to become licensed at the doctoral level, that type of thing. So you've gone through one facet of it, now you're going through another part of it. So and there's that theme, like lifelong learning.
yeah, it doesn't, and you can't really stop because the clients don't let you. You
Yeah.
have to be on your toes,
Yeah.
and they're coming at you with all kind of stuff, and it's like, whoa, let me go back.
Yeah. So how do you deal with stress or anything like that?
Yeah, stress.
Yeah.
Oh, what's that? No. I don't know. I just sometimes my days I'll see 6, 7 people, and it's sometimes they are in full crisis.
Right.
Sometimes they need to be put on a 5150 in the hospital because they're danger to self, and it's just,
Yeah.
it just doesn't stop. And some days I just want to fall under my covers.
Right.
And some days I do. Some days, sometimes I'll take a few days off, which because I'm in private practice, I have this luxury that a lot of people don't have in the community-based settings. But at the same time, there's this intensity that's there, and it's just, it comes in waves. I just have to kind of just hold on tight and say, okay, this week I'm going to allow this much, and if it gets a little too much, I go do some yoga or go for a run. We live by, beautiful ocean, so I'll go kayaking.
Nice.
I see you surf, so I said I wanted to learn how to surf. But yeah, it's just that constant that you have to be able to get used to the ups and the downs. It's a great job, and again, just having a psych degree, master, doctorate level, you can do so much. I wasn't even aware really when I started. It gives you a quite amount of flexibility that some jobs don't have. So you can be a professor, you can do a lot. It's fun. It's fun. I wouldn't not do it. I think this is was a calling for me.
All right.
Ups and downs.
Cool. So it seems like you're still passionate about it and you're still enjoying it.
Yeah, it's fun. It's fun times. But if anyone wants to contact me, I can help them talk to people, or if they need just some individual guidance, if you can give them my phone number, and I definitely can reach out.
All right. I will send them some contact information. Maybe I give them your email, and they can contact you from there. All right. Thank you for your time. I appreciate it, Doctor.
Sorry, I just had my coffee, so I started a little.
No worries. No worries. It's good.
I made up. Okay.
All right, let's stop recording.